Hey everyone, and welcome back. We're doing a deep dive today that might feel a little intense, but it's so important. We're going to be talking about some of the things that can go wrong during pregnancy, complications. And we're going to be looking at it all through excerpts from medical textbooks.
Yeah, pregnancy complications. It's definitely heavy stuff, but like you said, it's important. And, a lot of people just don't know about it or don't want to think about it. But really, the more you know, the better. It can really help you feel more in control.
Exactly. So today, we're going to cover 5 main complications. We're going to talk about spontaneous abortion, which most people know is miscarriage.
Mm-hmm.
Then there's ectopic pregnancy, hyperemesis gravidarum.
Ooh, that's a mouthful.
Right. Then we'll dive into placenta previa, and finally, placenta abruption. Ready to jump in?
Let's do it.
Okay, so let's start with the one that I think most people have at least heard of, even if they haven't experienced it personally, miscarriage. Our sources tell us that miscarriage is the most common cause of bleeding during the first trimester.
Yeah, that's right. And to be specific, the medical definition of a miscarriage is a pregnancy loss that happens before 20 weeks, or if the fetus weighs less than 500 grams.
Okay, that makes sense. So what causes a miscarriage? It seems like there's so much mystery surrounding it sometimes.
Well, it's tough because there isn't always a clear answer. Sometimes it's because of chromosomal abnormalities, problems with the chromosomes in either the sperm or the egg. Sometimes it's an issue with how the embryo implants in the uterus. There are also things like exposure to certain drugs or infection, underlying health conditions in the mother. And sometimes, honestly, we just don't know.
It must be so hard to not have answers. Our source actually breaks down miscarriage into different types, and I think that's helpful. It lists threatened miscarriage, imminent miscarriage, incomplete. There are a lot. And I think it's important to understand that there's not just one kind of miscarriage, but a whole range of experiences.
Yeah, absolutely. And there's one type, missed abortion, that can be especially tough emotionally. Basically, it's when the fetus has already passed away but hasn't been expelled from the body yet. And unfortunately, that situation increases the risk of a serious condition called disseminated intravascular coagulation, or DIC.
DIC. Okay, that sounds scary. What is that?
It's, imagine your blood's clotting system going completely haywire. DIC causes tiny blood clots to form throughout your body, blocking all those small blood vessels. At first, you might get symptoms like chest pain or shortness of breath, but then, as your body uses up its clotting factors, you start bleeding uncontrollably. It can be extremely dangerous, even leading to organ failure if it's not treated quickly.
Wow, that's a lot to take in.
Oh, yeah.
Okay, so given all these different types of miscarriage, what are some of the signs that someone should be looking out for?
Well, backache and cramping in the pelvic area are pretty reliable indicators. And then, of course, any bleeding, whether it's just spotting or heavier, should always be checked out by a doctor. Spotting can sometimes be totally normal, but it's always better to be safe than sorry.
Absolutely. So what happens when someone goes to the doctor to be assessed for a possible miscarriage? What's that process like?
Usually, the doctor will want to get a thorough medical history, ask about any previous pregnancies, health conditions, things like that. They'll also check your vital signs, like your blood pressure and temperature. And of course, they'll want to carefully evaluate the bleeding, how much there is, what it looks like. Emotional support is also really important during this time, just having someone who listens and understands. Depending on the situation, they might order blood tests, an ultrasound, or a speculum exam to check the cervix.
Right. Our source also mentioned something called RhoGAM. What's that and why is it important?
Oh yeah, RhoGAM. So RhoGAM is a medication that's given to mothers who are Rh negative. If the baby happens to be Rh positive, the mother's body can see the baby's blood as like a foreign invader and start producing antibodies against it. This can cause problems in future pregnancies. RhoGAM basically prevents that immune reaction from happening in the first place.
So it's like a preventative measure to protect future pregnancies.
Exactly. It makes sure the mother's body doesn't develop antibodies that could harm a future baby.
That's really interesting. There was another instruction in our source that I thought was kind of surprising. It was the importance of collecting any past tissue. I can imagine that must be really difficult emotionally, but I guess it's important for medical reasons.
It is tough, but you're right, it can be really helpful. Sometimes analyzing the tissue can help doctors figure out what caused the miscarriage, which can be valuable information for planning future pregnancies.
Okay, that makes sense. Let's move on to another potential complication now. We're going to talk about ectopic pregnancy. This one really jumped out at me because Our source says it happens in about 2% of pregnancies, and that number is actually increasing in the U.S.
Yeah, it is concerning. An ectopic pregnancy is when the fertilized egg implants outside of the uterus, usually in one of the fallopian tubes.
Okay, and why is that such a dangerous situation?
Well, the fallopian tubes are just not meant to support a growing embryo. As the embryo gets bigger, it puts a lot of pressure on the tube, and eventually it can cause the tube to rupture. That leads to internal bleeding, which can be life-threatening.
That's scary. Our source actually has some illustrations that show all the different places where ectopic implantation can occur. It's kind of wild. It's not always just the fallopian tubes.
Yeah, that's why early diagnosis is so important. If doctors know where the embryo is implanted, they can figure out how to treat it.
So what are some of the things that might make someone more likely to have an ectopic pregnancy? Are there any risk factors?
There are a few, yeah. A history of pelvic inflammatory disease, or PID, is a big one. Smoking is another one. And previous ectopic pregnancies also increase the risk.
And one of the things that really stood out to me is that symptoms might not even show up for weeks. That seems like it would make early detection really difficult.
You're absolutely right. It's a tricky one. That's why early ultrasounds are really important, especially for women who have any of those risk factors we talked about. Catching it early can make a huge difference.
So if someone does start experiencing symptoms, what should they be looking out for?
Well, sharp, very localized pain is a key symptom. It's usually on one side of the lower abdomen, and sometimes it can even radiate up to the shoulder. You might also have some vaginal bleeding or spotting, but that's not always present.
Our source also talks about the risk of hypovolemic shock if the fallopian tube ruptures. Isn't that when the body loses too much blood too quickly?
Exactly. And that is a medical emergency. It needs immediate attention.
Yeah, okay, that all sounds really serious. How do doctors diagnose and treat an ectopic pregnancy?
Usually they start with a pelvic exam to feel for any tenderness or masses. Then they'll do blood tests to check the levels of HCG, the pregnancy hormone. And a transvaginal ultrasound is often used to see exactly where the pregnancy is located. The treatment then depends on whether or not the fallopian tube has ruptured.
So what happens if it hasn't ruptured? What are the treatment options then?
Well, sometimes they can use a medication called methotrexate. It basically stops the embryo from growing, and the body reabsorbs it. It's less invasive than surgery.
But if the tube is ruptured, surgery is the only option, right?
I'm afraid so. When a rupture happens, it's an emergency situation, and they have to operate to stop the bleeding. A lot of times, they have to remove the affected fallopian tube, too.
We've already covered a lot of ground with just these two conditions.
Yeah, it really makes you think, huh? About how much can actually go wrong when you're pregnant.
Absolutely. And speaking of things that can go wrong, let's move on to hyperemesis gravidarum.
Ooh, try saying that 3 times fast.
Right. And I know some people listening might be thinking, isn't that just morning sickness?
Yeah.
But our sources are very clear. This is not your average morning sickness.
Yeah, it's a whole other level. And it's important to understand the difference.
Yeah.
You know, hyperemesis gravidarum is way more severe than typical morning sickness. We're talking extreme nausea and vomiting. Like so bad that it can actually lead to some pretty serious health complications.
Oh, wow. I can't even imagine. What kind of complications are we talking about here?
Well, because you're constantly throwing up, dehydration is a huge concern. Electrolyte imbalances too, which can then lead to weight loss, fatigue, and it can even affect your organs. And for the baby, it can really impact growth, potentially leading to low birth weight or even developmental problems.
That sounds absolutely awful. So what kind of support can someone get if they're struggling with hyperemesis gravidarum? Is there anything that can help?
Oh yeah, there are definitely things that can help. Treatment really depends on how severe it is, but it can range from dietary changes to medications. Sometimes they'll even start by having you avoid food and drinks completely for a little while, just to let your stomach settle.
Yeah.
NPO, like nothing by mouth. Then they'll slowly introduce clear liquids and bland foods.
Yeah, that makes sense, like easing back into eating.
Exactly.
And smaller, more frequent meals can be easier to tolerate too.
Right. And I'm guessing avoiding any food triggers is key here.
Absolutely. Anything that triggers nausea is a no-go. Strong smells, greasy foods, even talking about food can be tough, which is hard because everyone always wants to talk about pregnancy cravings. In more severe cases, IV fluids might be necessary to help with hydration and electrolyte balance.
It sounds really challenging.
Wow.
Our source also lists several medications that can be used.
Yeah, there are some good anti-nausea medications out there which can be really helpful for reducing vomiting. And there are also meds that help regulate how quickly your stomach empties, which can help with nausea too. It's good to know there are options. I imagine emotional support and rest are super important too. I mean, this sounds incredibly draining, both physically and emotionally.
You're so right. Having a supportive network of friends and family can make a huge difference. Even professional counseling can be really helpful. Just having someone to talk to who understands what you're going through can really help with coping.
Absolutely. Okay, let's move on to the next complication on our list. Placenta previa. I'm looking at the visuals in our source, and it looks like there are three main types: low-lying, partial, and complete. Can you explain what's happening here?
Sure. So placenta previa basically happens when the placenta implants too low in the uterus. Like it's either partially or completely covering the cervix. And as the cervix starts to thin and dilate, getting ready for labor, it can cause the placenta to detach. And that's what leads to bleeding.
So instead of the placenta being up top and out of the way, it's in the wrong spot.
Exactly. And that can cause problems as the pregnancy goes on.
Makes sense. So what are some of the things that might make someone more likely to develop placenta previa?
There are a few things, yeah. Having a previous C-section is a big one. Also, cocaine use during pregnancy, and then things like being over 35, having had multiple pregnancies, or a history of uterine surgery can increase the risk too.
So if someone has any of those risk factors, it's extra important to be aware. What's the main symptom they should be watching out for?
The main thing is painless bleeding. That's really the hallmark sign of placenta previa. And it can be unpredictable too, starting and stopping on its own, which can be scary.
That sounds alarming. So what can be done to manage placenta previa if it does occur?
Well, the main goal is to prevent further bleeding and protect the baby. Bed rest is usually recommended, and they'll monitor any bleeding very closely, checking the baby's heart rate a lot too. And of course, having blood available just in case a transfusion is needed.
Yeah, our source is very clear about that. Complete vaginal rest is essential.
Right, exactly. It means no sex, no tampons, no douching, and definitely no vaginal exams unless it's absolutely necessary. You don't want to do anything that could irritate the cervix or put pressure on it.
That's a lot of restrictions. What if the baby is premature?
Well, if the baby is far enough along that it could potentially survive outside the womb, they might give the mother corticosteroids. Those help the baby's lungs mature faster. And sometimes they use medications called tocolytics to try to delay labor for a bit, which can give the baby a better chance.
So it's all about trying to balance the needs of both the mother and the baby.
Exactly. It's a delicate balance. And in the long term, how placenta previa is managed really depends on the severity and the individual situation. For grade 1 and 2, where the placenta is only partially covering the cervix, a vaginal delivery might still be possible. But for grades 3 and 4, where the placenta is completely covering the cervix, a C-section is usually necessary.
Yeah, that makes sense. You wouldn't want to disrupt the placenta even more during labor.
Exactly. The source actually has a whole table that goes into detail about the different grades of placenta previa and how they're usually managed. It's worth checking out if you want to learn more about that.
Great tip. Okay, let's wrap things up with our final complication. Placenta abruption. So what exactly is happening here?
Placenta abruption is when the placenta separates from the uterine wall too early. And how serious it is really depends on how much of the placenta detaches.
The visuals in our source are really helpful for this one, showing the different types of abruptions: marginal, central, and complete.
They really are. It's important to understand those different types because they can have slightly different symptoms. And the causes can vary too, but some of the most common are maternal hypertension, cocaine or methamphetamine use, and any kind of trauma to the abdomen.
So how would someone know if this was happening to them? What are the symptoms?
Well, the biggest red flag is sharp, intense abdominal pain. And the abdomen often feels really rigid, almost board-like to the touch. The amount of bleeding can actually vary depending on the type of abruption, which can be a bit confusing.
Wait, so the bleeding isn't always a clear indicator?
Not always. With a marginal abruption, you might see more bleeding, but the pain might not be as bad. But with a central abruption, where the placenta detaches in the middle, the bleeding might be hidden inside the uterus. So you might not see as much blood, but the pain will be much more intense.
So if you have any of those risk factors and you start experiencing that kind of pain, it's time to get to the hospital ASAP.
Absolutely. Placenta abruption is a serious medical emergency that needs to be treated right away. Every minute counts.
Wow, okay. So what happens in an emergency situation like this? What are the first steps?
The first thing they'll do is try to stabilize the mother. That might mean IV fluids to replace lost blood, oxygen if they need it, and they'll be monitoring vital signs constantly. They also need to make sure the baby's doing okay by checking the heart rate. And since placenta abruption can sometimes trigger DIC, that blood clotting problem we talked about earlier, they have to watch for any signs of that too.
Right, so it's like a chain reaction of potential problems that need to be addressed all at once.
Wow. Yeah, it's a lot to manage. And then there's the question of delivery, which often needs to happen pretty quickly, either vaginally or via C-section, depending on how bad the abruption is and how far along the pregnancy is. The goal is to get the baby delivered safely as soon as possible.
So in a situation like this, time is of the essence.
Absolutely. And there's one thing that's really important to remember. No vaginal exams.
Really? Why is that?
Because doing a vaginal exam could actually make the abruption worse, so they avoid it completely in these cases.
That makes a lot of sense. You wouldn't want to do anything that could potentially make the situation more dangerous. This has been such an eye-opening deep dive, really. It's incredible how much can go on during pregnancy that most people don't even know about. What are your final thoughts for our listeners as we wrap up our discussion of these potential complications?
Yeah, it can be a lot, for sure. But, I think what's really important to remember is that the more you know about these things, the more prepared you can be. It's all about advocating for yourself, asking the right questions, and feeling empowered to make informed decisions about your pregnancy and your health.
I couldn't agree more. And it's not just about yourself either. It's about being able to support the people in your life who might be going through these challenges. Your friends, family, even just having a basic understanding of what they're dealing with can make you a better, more supportive friend or family member.
Absolutely. And, even though we've talked about some pretty serious stuff today, it's important to remember that most pregnancies actually go just fine. These complications, thankfully, are not the norm. But just being aware of them, knowing what to watch out for, understanding the potential risks, it can really make a difference if something does happen.
That's a great point. It's not about dwelling on the negative or getting scared, but about equipping yourself with knowledge so you can feel more confident and prepared for whatever comes your way during pregnancy.
Exactly. And, if you're interested in learning more, I definitely encourage you to check out the sources we used for this deep dive. The medical textbooks we've been referencing have a ton of information. They're a great place to start if you want to dig deeper into any of these topics.
Always good advice. So as we wrap up this deep dive into potential pregnancy complications, what's one final thought you want to leave our listeners with?
I think it comes down to this. Pregnancy is an amazing journey, but it can be unpredictable. So don't be afraid to ask questions, advocate for yourself, and trust your gut. Surround yourself with a good team of healthcare providers and lean on your support system, your friends and family. You are your own best advocate, and you deserve to feel informed and empowered every step of the way.
Perfectly said. Thanks so much for joining us on this deep dive, everyone, and we'll catch you next time for another fascinating exploration.